Well, good afternoon. So I'm Laetitia Messner. I'm the Chief Clinical Officer of Quantum Surgical, and I'm happy to share with you the story of our company, which is a medical robotics company focusing on cancer care. So once upon a time, actually 7 years ago, Bertin, Fernand, Lucien, and Sophie co-founded Quantum Surgical, the company, in Montpellier, so in the sunny side of France. Now we are 120 in France, but also in the US, where I am currently living. We also have an international board of directors with seasoned industry veterans, but also Ali Bridge, investment fund that invested in our current company, but also in the previous venture. A couple of words about the track record of our co-founders. So every new adventure starts with a blank page, but actually they all were in the Medtech surgical adventure with the LSI robot. So they started on heart tissue, surgical robotics, on orthopedics, brain, and spine. And after having sold the company in 2016 to Zimmer Biomet, they decided to go on a new adventure with Quantum Surgical in the soft tissue space. And talking a little more about cancer, which is actually where we focus, well, we all know that the numbers are huge and still increasing. And if we focus on the different indications that we are targeting, so abdomen, lung, and also bone, it's nearly 30% of cancer death worldwide in 2020. Where we focus currently with Quantum Surgical is interventional oncology. So interventional oncology is a pretty new specialty. It's one of the 4 pillars of cancer care, alongside medical radiation and surgical oncology. It's pretty new, but still, it has been fastly increasing because it really fits into value-based healthcare. Why? It's minimally invasive procedure. It's limited scarring. It's limited complications. It's limited hospital stay. What we do at Quantum is not invent a new therapy. It's really identifying treatments that have already proven benefits. So where the clinical and scientific publications are there and they are already incorporated in the scientific guidelines, whether it's the European ones or the American one. But the problem is currently physicians still do these freehands and they face different pain points. First one is they really have to locate the tumor. I mean, we're here for image-guided intervention, so seeing the tumor is one of the main important facts. Then they have to drive the needles to the tumor and having their hands in the gantry and advancing the needle step by step. And it's not just one needle, sometimes it's multiple needles, and they have to respect a specific pattern and specific spacing, which becomes more and more complicated. Once the needles are in, you burn the tumor, whether by heat, by cold, by an electric current, and then the physician has to see if the tumor has been completely destroyed with the right margin. What do they do currently? They will look at the image at the top, look at the image at the bottom, and guess if the tumor is rightly covered with the right margin. The problem is guessing, because if it's not completed, well, you might have a risk of a recurrence, which is not a good idea for the patient. So what did we do? We invented the Epione robot, which we believe is a breakthrough in percutaneous ablation. And because actually images are better than words, I'll just show you a quick video of a case that was done in Baptist in one of our centers.
We're now going to get the robotic arm aligned with our trajectory. We're now going to use a coaxial needle. It's called a Murphy needle for us to create a skin incision. Traditionally, these ablations are done freehand with CAT scan guidance, where the operator would make adjustments to the probe from the skin to the target. And with this device, we're now able to plan the trajectory from the skin to the target, and we're able to advance the needle with just one push, rather than having to do multiple adjustments and check scans. So we're done with our treatment, and I just want to show the size of the incision. As you can see, it's about a couple of millimeters, and that's the size of the incision that we make to treat the patient, and now we're just going to use a Band-Aid. This was a very successful procedure, and we just confirmed the ablation zone with a contrast-enhanced CT after the procedure to make sure that we got the lesion along with a good margin, and also make sure that there were no complications.
So going back to the clinical adoption of our system, we have already treated 600 patients on our installed base, which is in Europe, but also in the US. And if you ask some of our key opinion leaders, they will give testimony that backs our value proposition, which is whether that the robot is more efficient, it standardizes the practice, and therefore young physician residents can actually have the same level of performance with the robot than experts, and experts can do things that they would never have dreamed to do before without the robot. So in a nutshell, if we look at the clinical benefits of the Epione robot, it really accompanies and assists the physician throughout the procedure, from the planning to the targeting to delivering the treatment and to assessing the treatment. And I mean, for that, we have also 25 families patents, so we have a total freedom to operate. Talking about a value proposition, so we are here to democratize percutaneous ablation. And what it means is that thanks to our technology, we really want to streamline the process, standardize the process, so that the physician feels more at ease to do this procedure, and therefore more patient can benefit from these curative treatments. And it's not just a benefit for the patient, it benefits to all the stakeholders. So it's the hospital, the patient, the physician, because with Epione you can treat more, better, and faster. If we move to our regulatory path, we already have the CE mark on the abdomen, but also on the lung. We are FDA approved on the abdomen, and I'm happy to share with you that we've done our first patient on bone procedure just a couple of hours ago, and it went really well. In terms of positioning, we are really in the middle of the environment with imaging companies and also ablation companies. So of course, it also leads the way and opens the door to some strategic partnerships. Talking about our market, the market is huge, and we believe that with robotic, it will be even bigger. And if we wanted to really tackle the whole US market by 2040, we would need 7,000 Epione in the US. In terms of business model now, so we really adapt to the market. So we offer different kinds of product revenue, so we can actually suggest capital sale, pay-per-case, rental. We also have recurring revenue with our service contract and with consumables. And as I was saying, we're always looking for a strategic partnership to really do an efficient bundle for the hospitals. Our aim is to have 300 Epione by 2028, and that's why we're currently raising $40 million for a B round. Our aim is really to scale up the company, mostly on sales and marketing, but also on the production side, so that more physicians, and therefore more patients, can benefit from these curative treatments. So in a nutshell, our CTO, Christophe, and myself are here at LSI. So if you want to write a chapter of our story with us, well, feel free to come and reach out. Thank you.